Video opens with Dr. James in a professional, empathetic setting. Dr. James. Hello, everyone. Did you know that over 70% of strokes in older adults happen right at home, and that most of them give warning signs hours before the event, yet almost no one notices them? It's true. Strokes rarely strike without warning. The real problem is that these crucial warning signals are often ignored because they seem minor. Perhaps a bit of dizziness when standing up, or a fleeting numbness in the arm, or even slightly slurred speech. And too often people think, oh, it's just fatigue, it's my age. But it isn't. Stroke is now the leading cause of physical disability among older adults. And shockingly, according to the World Health Organization, 1 in 4 adults will experience a stroke in their lifetime. Globally, stroke affects over 15 million people annually. And the WHO also states that a significant portion of these cases could be prevented with better information and attention to these early signs. What almost no one talks about is that many of these symptoms appear during the night or in the early morning hours, when blood flow slows down, blood pressure fluctuates, and the body becomes more vulnerable. That's why, in this video, we're going to uncover the 7 most commonly ignored signs of stroke in older adults. These are signs that often manifest quietly, but they can be the only warning before a tragedy. We'd love to hear your age and where you're watching from in the comments, so we can see how far this vital knowledge reaches. Please watch until the end and share this video with those you love, because this information truly can save lives. Sign number 1. Difficulty with speech or understanding others. If you wake up and notice that you're struggling to speak, if words don't come out as usual or sound garbled, be on alert. This is one of the most common signs of stroke, especially in older age. It often happens in the early morning hours when brain circulation is still slowed from a night's rest. It could also be the reverse. Someone is talking to you, but you can't understand what they're saying. Phrases might seem meaningless, or your brain feels too slow to process them. This disruption in speech or comprehension might only last a few minutes, which is why it's often ignored by people over 60 who believe it's just temporary. However, according to the U.S. National Institute of Neurological Disorders, these changes in speech are one of the first symptoms of an ischemic stroke, the kind caused by a blocked artery in the brain. As we age, especially in our senior years, the risk of stroke significantly increases. The aging brain becomes more vulnerable to fluctuations in blood pressure and blood flow, particularly during sleep. So, if this happens to you, even if it passes quickly, don't dismiss it as normal. Seek immediate medical attention, because when the brain stops sending signals, time becomes the most critical factor. Sign number 2. Sudden weakness on one side of the body. If you're an older adult and have woken up feeling a strange sensation in your leg, a weakened arm, or as if one side of your body is just off, do not ignore it. This sudden weakness, affecting only one side, typically an arm or a leg, is a classic sign of stroke, and often appears in people over 60, especially right after waking when the body is still adapting from rest. The issue is that many older individuals attribute this to aging, thinking it's just how they slept, or even a drop in blood pressure. But when the weakness is asymmetrical, meaning it affects only one side of the body, it usually indicates that the brain is suffering from a lack of blood supply. According to the U.S. Centers for Disease Control and Prevention, this one-sided weakness accompanies over 80% of ischemic stroke cases, and it might last only a few minutes before disappearing. But that doesn't mean everything is fine. In fact, it could be a transient ischemic attack, TIA, a small warning before something far more serious occurs. So, if you're an older adult and notice your leg giving out or that you couldn't firmly hold a glass, even if you felt better afterward, take it seriously. In older age, The time between a warning and a full-blown stroke can be short, and every lost minute truly matters. Sign number 3. Blurred vision or partial vision loss. If you're over 60 and have woken up with vision disturbances, everything blurry, dark spots, or a sensation that the world has tilted, this warrants immediate attention. In older age, changes in vision over time are common, but when they occur suddenly, without explanation, and especially in only one eye, it can be a sign of stroke. In many cases, a stroke affects the brain regions associated with vision, resulting in partial loss of the visual field, double vision, or a sudden dimming. According to the World Health Organization, these types of visual disturbances are present in a significant number of older adults with stroke and can be mistakenly attributed to common age-related issues like cataracts or eye fatigue. But there's a clear distinction. These symptoms appear suddenly and often disappear after a few minutes, which is confusing. If this has happened to you, even if it passed, do not ignore it. Your body might have recovered, but your brain may be signaling for help. Sign number 4. Sudden dizziness and loss of balance. In older age, a slight dizzy spell when getting out of bed might seem normal. But when dizziness appears suddenly, intensely, accompanied by a loss of balance or unsteadiness when walking, it's an alarming signal. Many older adults describe this feeling as if the ground has shifted beneath them. Their body sways, their head spins, and their steps become uncertain, even when standing still. This can indicate that the brain is experiencing a lack of oxygen, and in a stroke, the area responsible for balance is often affected first. According to the World Federation of Neurology, such symptoms are characteristic in people over 60 and often manifest in the morning when blood pressure is still stabilizing. The problem is that many link this to inner ear issues, or simply say it's another sign of old age. However, dizziness caused by a stroke is different. It usually comes on suddenly, might prevent someone from walking in a straight line, and in some cases is accompanied by nausea or distorted vision. If this has happened to you, even if it resolved in a few minutes, take it seriously, because in older age, what seems like a minor imbalance could be the first step towards a much more severe problem. Sign number 5. Sudden, severe headache, unlike any other. Have you ever experienced a headache so intense, so sharp, that it felt like something was tearing inside your head? This isn't a migraine. It's not tension. It's a pain that begins abruptly, without warning, with no apparent cause, and envelops your entire head within seconds. Such pain must be taken seriously, especially after 60, because in many cases, this is how a hemorrhagic stroke manifests. Unlike an ischemic stroke, which results from a blocked vessel, a hemorrhagic stroke is caused by a ruptured vessel inside the brain and is often accompanied by symptoms like nausea, vomiting, confusion, and even a stiff neck. The World Health Organization warns that such sudden and severe pain, especially in older adults, is one of the most serious and dangerous signs of bleeding in the brain. Many older individuals make the mistake of thinking it's just a normal headache, taking pain relievers, trying to lie down, waiting for it to pass. And sometimes it does seem to pass, but the pressure inside the skull continues to build silently until it's too late to do anything. If you're an older adult and feel such an unusual pain, unlike any you've ever experienced, do not wait for it to ease. Do not try to rest. Seek immediate medical attention, because in such a case, time isn't just valuable. It's the only thing that can save you. Sign number 6. Sudden confusion or changes in thinking. You're talking as usual, and suddenly you lose your train of thought. You forget what you wanted to say, don't understand what others are talking about, or start acting strangely, as if you're somewhere else. This sudden confusion, especially if there was no prior diagnosis of dementia or Alzheimer's, can be one of the most serious signs of a stroke. Unfortunately, it's also one of the most ignored symptoms in older age. Many believe that forgetfulness, slowed thinking, or incoherent speech is normal after 60. But if this occurs suddenly, it's possible the brain isn't getting enough oxygen and a stroke is already developing, especially in areas responsible for speech, memory, and consciousness. According to the European Stroke Organization, such abrupt changes in mental state are present in many diagnosed cases each year, primarily in people over 65. It's often confused with fatigue, dehydration, or the initial signs of Alzheimer's. But there's a clear difference. A stroke manifests abruptly. An older person feels normal, and then a few minutes later cannot sustain a conversation, recognize faces, or think logically. If this has happened to you, even if it didn't last long, even if everything normalized afterward, do not ignore it. What seems like a simple memory problem could be a signal from your brain about serious danger. In older age, any sudden changes in thinking should be taken seriously, because with your brain, you don't take risks. You care for it, and urgently. Sign number 7. Sudden numbness or tingling on one side of the body. If you are over 60 and wake up with a feeling of numbness in any part of your body, an arm, a leg, or even half of your face, accompanied by tingling, do not dismiss this as a normal part of aging. Often, these sensations are attributed to having slept on a limb. But if the tingling occurs suddenly and only on one side, especially in older adults, it can be a critical warning that blood flow to the brain has been disrupted. In older age, even minor discomforts are often perceived as normal. However, according to the World Stroke Organization, localized numbness is one of the most underestimated early symptoms in people over 65. It often appears when getting out of bed or in the middle of the night, when blood pressure is unstable and the brain isn't fully awake. The danger lies in the illusion. The tingling might pass in a few minutes, making it tempting to ignore. But each such episode could be a transient ischemic attack, indicating that a part of the brain is on the verge of a full stroke. Therefore, if you notice sudden numbness or tingling only on one side of your body, do not wait for it to normalize. Seek immediate medical attention. In older age, every minute is crucial to avoid severe consequences or a life-threatening situation. Recommendations. Upon experiencing any of these symptoms, the first step should always be to contact your primary care physician. It doesn't matter if the symptom passed in a few minutes or seemed mild. In older age, there are no harmless symptoms when it comes to the brain. Ideally, older individuals should be under regular observation by a specialist who knows their medical history and can objectively assess their stroke risk, as well as prescribe necessary tests and offer personalized prevention advice. Controlling blood pressure is also key. Hypertension is one of the main causes of stroke in older adults and must be regularly monitored. If you take medication to lower blood pressure, strictly adhere to your regimen and never discontinue treatment on your own. Another important recommendation is to care for your circulation. Stay active, even if it's just light walks or daily stretches. This helps improve blood flow and reduces the risk of blood clot formation. Nutrition also plays a role. Avoid excess salt, unhealthy fats, and excessive alcohol consumption. Prioritize natural foods rich in potassium, magnesium, and antioxidants. These protect your blood vessels and heart. And finally, it's equally important to listen to your body. Many older adults get used to enduring discomfort, ignoring mild symptoms, thinking it's just age. But these are actually signals, and the earlier you respond, the higher your chances of avoiding serious consequences. In older age, the secret is constant vigilance and the decision to take care of yourself every day. We encourage you to subscribe to the channel to receive new videos with expert insights into elder health and learn to recognize the early signs of serious conditions like stroke. Conclusion: thousands of older adults today live on the brink of a stroke without knowing it, because the symptoms appear subtly, quietly, and are ultimately ignored as just another sign of aging. But now you know: speech difficulties, weakness on one side of the body, sudden dizziness, blurred vision, an unusual headache, confusion, or tingling. None of this is normal after 60. These are signals, and every ignored signal could be the last. So please, share this video with those you love, your parents, grandparents, neighbors, or friends, because sometimes simple information can save a life. Thank you for watching. Strong health to you, and we'll see you in the next video.